The AON Lab was started in 2018 at the formation of the company itself. The laboratory is the heart and soul of the diagnosis. The vision of the AON Pathology Lab is to internalize the laboratory to support directly the AON company, the clinics, and ultimately our patients, as compared to a reference laboratory where the material is sent out to a third-party laboratory, or within a hospital setting where you have the pathology lab working in tandem, parallel to the clinic. We have it integrated into the company in direct support of the clinic.
With cutting-edge technology that produces quality results for our physicians, so they can make the best possible decisions for our patients and their treatment plan, ultimately providing the best possible care for our patients. Our lab is CAP accredited and CLIA certified, offering a wide range of services. Are highly educated and hold 4-year degrees, as well as state licensures and national certifications. Our highly trained client services team is available to answer questions, ensuring excellent communication with our practices.
Over the last 5 to 10 years, the idea of precision medicine has taken off, and it's supported by new technologies, primarily at the genetic level. Before we gave the generic diagnosis and had a generic treatment, now we're able to define those things much more individually, and so two people that might have in the past gotten the same treatment might now get very different treatments that target their specific diagnoses.
Our process begins when our samples get delivered. Our accessioning department will begin unboxing those samples. They will check the temperatures, check for any IATA violations that may have occurred. So that's really imperative for our clinics to follow our standard operating procedures as far as it relates to packaging and shipping, because the quality of our results is directly impacted by the quality of our samples. Once our bone marrow samples are processed and all of our pathology, those are sent off to their respective departments for testing. Each bone marrow receives comprehensive analysis and then additional testing as added on by our pathologist as needed. Once all testing is completed in any department, whether that's clinical or pathology, those results are immediately available in the EMR chart for the physicians to view. Our pathologists are also readily available to discuss cases with the oncologist and clinician. They will frequently provide their personal contact information in order to provide the best service possible.
By having everything in-house all under AON's umbrella, this leads to several advantages. First off, our turnaround times are actually superior when you compare it to the industry norms, which leads to a faster and quicker diagnosis, which leads to earlier times to get patients on treatment, and helps reduce anxiety that patients as well as their family members and caregivers have. As a physician, I find this tremendously gratifying.
Patient satisfaction and physician satisfaction is simple for me. We always want to reduce turnaround time, giving our patients and our doctors a shorter and better test in a shorter amount of time. Number two, anytime we can develop a test or improve our operations to increase patient outcomes is always a win for us. And of course, if we can marry those first two with driving revenue and increasing profits to our bottom line, then that is the secret to success for us. We're always trying to optimize operations here at the Central Lab, as well as optimize operations for the clinic side labs as well. But one of our most forward-facing projects right now is we're actually assessing different partners for NGS testing to bring to our network and our patients.
Centralizing NGS testing in-house allows us to build that contract with our payers, offers faster turnaround times, and improves patient care. AON Lab has accounts with reference labs, such as LabCorp, NeoGenomics, Quest, and GenPath. And if we are unable to process the sample in-house, then we have those accounts in place so that way we could forward that order and the specimen to the reference lab. Most of our reference labs are interfaced with our EMR. Therefore, once the report is released, the physicians and the patients have access to that record as well.
We've seen significant growth in the laboratory since our inception. And with the programs that we're looking at now and some of the efficiencies that we're realizing, we're poised and ready to receive even more growth.
Last year in 2022, we processed 3.5 million clinical laboratory tests, over 1,600 bone marrows, and an additional 2,100 peripheral blood tests for flow cytometry. And in 2023, we're on track to outpace that number as well.
The extremely unique aspect of our laboratory is what's being done in the physician-owned lab, from increased turnaround times, improved quality of reports, increased communication, and the financial benefit, the physician-owned lab is a unique benefit to the clinical practice that you're not going to find in any other setting.
Together, we are AON, delivering better care, working together as one.